Hello, my name is Nick Wilson and I am Director of Health and Safety Services here at Ellis Whittam. I wanted to share with you some of the ways we support general practices and independent pharmacies to fulfil their health and safety obligations and meet the requirements of the Care Quality Commission. Our advice is trusted by 17,000 businesses across the UK, including large organisations such as the National Pharmacy Association. We strive to make it easy for businesses to operate. As part of this commitment, Ellis Whittam is the first health and safety consultancy practice to achieve assured advice status from an enforcing authority known as the Primary Authority. At a time when healthcare providers are already under pressure to expand their services and operate at scale, it's not easy for busy employers and managers to give health and safety the time and attention it requires. However, ensuring the safety of staff, patients and visitors should be a key priority, especially at a time when you may need to be required to increase your number of employees to support your growing community. Practice managers and pharmacy managers usually take a high level of responsibility for the day-to-day running of their sites. They're all skilled all-rounders, but do not necessarily have the knowledge to deal with competently assessing the premises and reviewing and drafting new policies and handbooks to meet regulatory requirements for your health and safety. Time is always of the essence, and it's important regular necessary checks do not slip down your priority list. After all, it is managing partners who will be accountable for explaining the reasons incidents happened and demonstrate the ongoing steps the organisation takes to mitigate risks. Ellis Whittam's approach to health and safety can help you meet the requirements set out by the Health and Safety at Work Act and the Care Quality Commission. The scope of our advice encompasses many aspects of how day-to-day risks are managed by your staff to ensure you successfully deliver a safe environment for your employees, patients and visitors. Are they safe? Is the first of 5 key questions the CQC will always ask about your services during an inspection. Inspectors will look at how risks are identified and managed in order to help them understand whether your service is safe. Documentary evidence is vital to them during an inspection, and if you are unable to demonstrate compliance, an inspector is unlikely to be satisfied you are complying with the legal requirements. When it comes to reviewing whether your standards meet legal requirements of the Care Quality Commission, here are 5 important questions you need to consider. Number 1. How do you manage health and safety on an ongoing basis? Secondly, when did you last carry out a general risk assessment and fire risk assessment of your premises? Number 3, who is your competent person and are they qualified to fulfill this role? Number 4, when did the last review take place and when did you last update your policies and handbooks? And number 5, what ongoing training do you provide your staff? And how do you monitor the desired outcome is being achieved? Our health and safety consultants will help you to create a safe environment for your employees, patients and visitors. They will conduct an on-site risk assessment to identify areas of non-compliance and they'll work with you to take remedial action. They will review areas such as fire safety, lone working, personal protective equipment, harmful substances, even look at your training, violence and work at height procedures. They will produce a bespoke health and safety policy and employee health and safety handbook, which will outline the important safety rules and procedures for your employees. They will introduce you to our health and safety software, which allows you to safely store, retrieve and modify important documents, receive automatic alerts when certificates or other actions are due, and help you maintain a paperless system of evidence of compliance that you can call upon during a health and safety and/or a CQC inspection. The system will allow you to identify risks in real time, which is especially useful if you operate across multiple sites. Our consultants will act as one of your legally required competent persons to give you complete confidence in your compliance. Our aim is to take the pressure off your already stretched management teams through hands-on support combined with a technology solution that will enable you to monitor and manage all your compliance through one easy-to-use dashboard. With Ellis Whittam acting as an extension of your team, you can improve efficiency and focus on developing your services for the benefit of your community. For further information, please do not hesitate to call us today to arrange a meeting with a regional business director who will review your current setup and advise on the best way to move forward with Ellis Whitton.